Hello, my name is Dr. Ahmed Mahgoub. I'm one of the pulmonary and critical care physicians here at KRMC, and today I'm here to talk about pulmonary fibrosis. Pulmonary fibrosis is a disease of the lung that makes it hard to breathe, as it causes progressive stiffness and scarring of the lung tissue, making it unable to transfer gases and eventually unable to breathe appropriately. We do have multiple risk factors for pulmonary fibrosis, of which smoking stands as number one risk factor for those fibrosis changes. Second, we have chronic exposure to toxic chemicals and certain dust particles such as asbestos and silica. Third, we have some form of autoimmune disease when your immune system gets to attack your own tissue as an abnormal disease. Also, we have some forms of pulmonary fibrosis that can run in families and are genetically inherited. Mild and initial cases of pulmonary fibrosis may be asymptomatic at all and you don't feel any symptoms. As the disease progresses, you will feel short of breath, begins with activity, and later on becomes with rest. Also, you have coughing, which is oftentimes dry. In addition to that, if your pulmonary fibrosis is induced by an autoimmune disease, you're going to have the symptoms of the autoimmune disease, mainly severe joint pains, skin rash, and significant dryness of your mouth and eyes. Pulmonary fibrosis is diagnosed initially with your history and your clinical presentation with symptoms. And then a breathing test will be needed to look at the pattern of your lung function on that breathing test, not only to diagnose pulmonary fibrosis, but also to distinguish it from COPD. Third, CT scan, which is advanced form of chest X-ray that can look inside your lung to look for a certain pattern that pulmonary fibrosis can do to your lung. And sometimes you need a biopsy. You need to get a tissue from the lung and study that tissue to confirm that what you're seeing and what you're feeling is really pulmonary fibrosis. Unfortunately, there is no treatment to cure pulmonary fibrosis. However, there are certain measures, if you do, can control the progression of pulmonary fibrosis, and you can live with it, such as you live with diabetes and high blood pressure. Of those measures, we have some supportive measures and we have some treatments. Supportive measures, quitting smoking will help to recover your lung functions. Second, oxygen supplementation when you become eligible. Third, pulmonary rehabilitation, that is a physical therapy for your lungs to strengthen your respiratory muscles and make you breathe better. Fourth, the respiratory pertinent vaccinations, namely the annual flu vaccine, pneumonia vaccines, and now COVID vaccination as well. We do have some treatments for pulmonary fibrosis. We do have two medications. They are called antifibrotic medication to slow the progression of that stiffness and scarring of your lung. We have some other medications still undergoing clinical trials. And at end-stage pulmonary fibrosis and for certain eligible patients, lung transplantation can be offered. After all, close follow-up with your lung doctor is very, very important and to be done on a regular basis. Thanks for sharing your time with me and watching our videos. For more information, please feel free to contact us or visit our website. Once again, this is Dr. Ahmed Mahgoub. Have a wonderful day and stay healthy.